Is functional medicine right for you? And better yet, the question you're probably asking is, will functional medicine work for you? Hi, I'm Dr. Arland Hill, and I'm here today to help you answer that question, but I also want to introduce, as a part of answering this question, the idea that I've come up with of the psychological divide as it relates to functional medicine. And I'll explain what that means because it's a key concept to understanding whether or not functional medicine will work for you. Now, let me introduce a continuum here for you that is critical to understand when you're thinking about implementing functional medicine into your lifestyle, or you're starting to seek out a functional medicine provider. First thing we want to think about here is your normal state of health, the ideal state of health. Now, let's be honest, if you're seeking out a functional medicine provider, you're probably not considering yourself ideal or in a normal, optimal state of health at this time. Here's the critical part that I want you to keep in mind with this, though, is that if you're not in this normal state of health, then that ultimately means that you're moving towards or moving downwards down this slippery slope towards a disease state. Now, there's a lot of different types of diseases that we can talk about here. We can talk about commonly discussed ones such as cardiovascular disease, dysfunction in the heart, if you will, disease of the heart. We can talk about diabetes, cancers, autoimmune diseases. We can look at degeneration of the neurological system, the brain. So there's a lot of different diseases that we could talk about. But when we think about any of these diseases, again, we're looking at moving from a normal state of health to a state of disease. And this was not something that took place in a matter of a day or a matter of a week. This took place over a longer time frame. Now, when you think about the body being in a state of disease, I want to break this down and give you a little different way of looking at this, because ultimately what you're truly in is a state of dis-ease. Now, that may seem like just a play on words here, but when you think about it, when the body is at ease, when things are working like they should, that's optimal normal health. When the body is not working like it should, when things are required like medications, that's when we start talking about a disease manifesting and your body is in dis-ease. So now if we think about this dis-ease, many people find themselves not in this state of overt dis-ease, but they know that they have symptoms and they know that they're not normal or optimal health either. So where are they at? Well, they're in this gray area, and this gray area creates a lot of frustration for individuals because they end up going to their doctors and their doctors can't find anything to point to, and many times the reason that is because they're focusing on things that are related to disease. Now, when we start to classify this area of this gray area, if you will, that's dysfunction. That means that the body has started moving in the wrong direction, and this dysfunction, these symptoms that you're dealing with, that's actually the physical expression of the dysfunction coming to light. So when we think about the gray area, these symptoms that no one's been able to put a finger on, that's your area of dysfunction. And now when you think about functional medicine and you're comparing this or maybe contrasting it to traditional conventional medicine models, this is where functional medicine really shines at, is in this area of dysfunction where you know you're not at this normal state of health, but you haven't reached this state of disease or dis-ease yet, as we'll label it here as well, and you're stuck in this middle ground of dysfunction. And so the more dysfunction that you accumulate over time, the closer you become towards a disease state. So with that in mind, if we can look at targeting this dysfunction and starting to turn some of that around, you can begin to move away from this trajectory towards a disease. Now, there is a psychological divide that determines whether or not you can do that. And this is a term I coined just watching patients over time that were successful with functional medicine versus those that were not successful with functional medicine. And granted, when we talk about this psychological divide, and you'll see how close that is to the disease state, when you stay above this psychological divide, and what that means is that you've made the decision and you have the understanding that the dysfunction that you're dealing with is a result of choices that you've made or choices that you have not made in your best interest, some of which you're aware of, but unfortunately some of which you're probably not even aware of either. And so once those decisions are brought to light, once those areas of dysfunction are brought to light and you can make better decisions around it, the individuals that can do that can make that psychological decision that they're going to be able to make those changes and commit to their care, can move back towards this normal, optimal state of health. But the individuals who can't do that, those are going to be the ones that continue on this trajectory towards disease. Now, one of the things I think is important to note is that you don't have to deal with this dysfunction. That doesn't have to be your everyday, and it doesn't have to be your future either. So when looking at where this can progress for you, this is not a one-way direction. You're not just necessarily always moving from normal to a state of disease. You actually have the ability to move backwards as well. And that's a choice, fortunately, you have the ability to be able to make as long as you know what to focus on through your efforts in taking part in functional medicine. So really the question becomes, well, will functional medicine work for you? Yes, functional medicine will work for you if you decide to be on the right side of this psychological divide. If not, it's not going to be the optimal choice for you, and conventional strategies to help mitigate your disease are the better option for you. You just have to know where you fall on the psychological divide to understand whether or not functional medicine is going to be a good fit for you or not. Hey, listen, if you want to know more about these types of topics, you want to know more about functional medicine, functional nutrition, how it can work for you and be of benefit to you, go to my website at drarlandhill.com. If you like the information in the video, make sure you give it a thumbs up. But also make sure you share this information. There's a lot of other individuals out there as well that are looking for different options in their healthcare. Let them know whether or not functional medicine is an option for them. Thanks for listening. I'm Dr. Arland Hill.